Hey guys, welcome to my YouTube channel, and in today's video we're going to talk about the sphenoid bone. So the anatomy of the sphenoid bone. So what we can see here, this is the sphenoid bone, and it has got many parts. So the many parts of the sphenoid bone, as you can see, this is the posterior side. So this is the posterior part of the sphenoid bone that you can appreciate here. So this is the posterior part of the sphenoid bone. And then we can see that this is the anterior part. So we have the posterior part and the anterior part of the sphenoid bone. Now, let us look at the main parts of the sphenoid bone. Then we'll look at the landmarks of the sphenoid bone, the bone landmarks, and then from there, we'll look at these little holes that we can see there. Those the foraminas. And then after the foramina, we are going to look at what is passing in those foramina. So, what we can see here that we have got this part, this central part here. You can see this is called the body of the sphenoid bone. So it is called the body of the sphenoid bone, which is this part. And then you can see that this part here, this brown part, we call it the lesser wing of sphenoid. So that is the lesser wing of sphenoid. And then this white bone part, this is what we are calling the greater wing. So we have got the greater wing of sphenoid bone, the lesser wing of sphenoid bone, the body of sphenoid bone, and we have this point which we are calling the sella tussica. So we can see here, this is the sella tussica. So these are the many parts of the sphenoid bone. So the lesser wing, the greater wing, and the body of the sphenoid. The other thing that we can see posterior here are these processes, these two processes. We call them pterygoid process. So that is pterygoid process that you can see there. So looking at the bone landmarks of the sphenoid bone, we are looking at the posterior side. So this is the posterior side. So as usual, we can see that we have got, this is the lesser wing, the greater wing, and then this is the body of the sphenoid. Now, we can see a lot of points. So, what do we call this area on top? So, this area, we call it the jugum sphenoidale. That is called the jugum sphenoidale. It is this top area. Then, what do we call this part here? This is kind of like an elevation that is here, sharp elevation. So, this one, we call it the limbus of sphenoid. So that is the limbus of sphenoid. Then what about this sulcus here? What do we call this sulcus? So this sulcus, it is called the prechiasmatic sulcus. This is where the chiasma is located. So we know that the two optic nerves, when they are coming, they are going to cross each other and form a chiasma at that point. So that is the point where the chiasma is, prechiasmatic sulcus. Then under here, we can see here this part. What do we call this part? This part is called the tuberculum sellae. So it's the tuberculum sellae. You can see the tuberculum sellae. And then from there, we have this region, this fossa here, which we are calling the hypophyseal fossa. The hypophyseal fossa, it is this fossa that is here. Okay, so this is the fossa. And then we also have this part here, this tubercle, or this process, we call it the midoclinoid process. Midoclinoid process. Then down here, you can see that we have this green part. So it's an elevation, in other words, this elevation here, this is called the sella tussica. That is the sella tussica that you can see there. So please don't confuse it with the apophyseal fossa. This is the sella tussica. And then apart from that, we have got this point here, this process. This one, it is called the posterior clinoid process. So remember, we had the anterior clinoid process. We had the middle clinoid process. The middle clinoid process, it's here. So this is the posterior clinoid process. So if we have got the posterior and the middle clinoid process, it means we also have the anterior. Anterior, it's this one. This is the anterior clinoid process. Okay, so just once more. So here we have got the jugum sphenoidale. This is the jugum sphenoidale. And then here we have got the tuberculum, the limbus of sphenoid. That's the limbus of the sphenoid bone. Then here we have got the prechiasmatic sulcus. Then down there we have got the tuberculum celli. Then here we have got our middle clinoid process. And then down here we have got our apophyseal fossa. Then here we have got the sella tussica. Then here we have got our posterior clinoid process. And then this is the anterior clinoid process. Then you can see here there is this red part. So it's kind of like a depression. There's something that passes here. So this red part, we call it the carotid sulcus. That is the carotid sulcus. So that is the region where you're going to find the internal carotid artery. The internal carotid artery. And then what else do we have? You can see that we have got these foramina, or these red holes. This one, this big here, we call it the supraorbital, the superior orbital fissure. This is the superior orbital fissure. So this one, we call it the superior orbital fissure. And then down here, you can see under the superior orbital fissure, there is this foramen. This foramen, we call it the foramen rotundum. Foramen rotundum. And then down here, we have this other big foramen. This one, we call it the foramen ovale. Foramen ovale, it is this point that you can see there. So don't confuse it with foramen ovale that is found in the heart. This is different. Then we also have another little hole here. At this point, this one, we call it the foramen spinosum. So we have got it. So we have got the foramen ovale and the foramen spinosum, which we can see there. Okay, then apart from that, we said this is the greater wing. This is the greater wing. And this surface here of the greater wing, we call the cerebral surface of the greater wing of sphenoid bone. And then this is the lesser wing that you can see there. That's the lesser wing of the sphenoid bone. Okay, and then we have this point here. That point, we call it the sphenoidolingula. This point is called the sphenoidolingula. So it is at the beginning of the carotid sulcus. Sphenoidolingula. What else do we have? We also have the sulcus of the auditory tube. So the auditory tube is passing here. And then that is the sulcus for the auditory tube that you can see at that point. Okay? And then, having talked about that, about the posterior part, we can come to the anterior part and try to appreciate what we can see on this sphenoid bone. So the anterior part, what does it have? So if you look at the anterior part, we have got this septa or a crest. So this septum or crest, it is called the sphenoidal crest. So that is the sphenoidal crest. And then here you can see that we have got this point that we call the sphenoidal concha. So the sphenoidal concha, it is simply this point here of the body of the sphenoid bone, the sphenoidal concha. What else do we have? We also have these openings for the sphenoidal sinuses. The septum. Okay, so we can see this is the opening for the sphenoidal sinus. So that is the opening of sphenoidal sinus that you can see there. What else do we have? So from here, from anterior view, you can see that here is the superior orbital fissure. And then you can see on top of the superior orbital fissure, there is another foramen. This one we call it the optic canal. That is the optic canal that you can see there. Okay, so optic canal, superior orbital fissure. And then you can see that here we have got those points that we saw outside. So you can see that this one here, this opening here, that's the optic canal. Then the superior orbital fissure. This is the foramen rotundum. And then we have got the foramen ovale that we can see here. and then we have got the foramen spinosum that is there. Coming back to the anterior part of the sphenoid bone, we can see that we have got this part here that we say the pterygoid process. So this pterygoid process has got two plates. So we can see this plate here is called the medial plate of pterygoid process, and then we can see this plate on the other side is called the lateral plate. So we've got the medial plate and the lateral plate, and then we have got this notch here. This notch that you can see, this notch here is called the pterygoid notch. That is a pterygoid notch. And then you can see this spine here, it's a pterygoid annulus. So this end here is a pterygoid annulus that you can see the yellow one. This is the pterygoid annulus. And then you can see this spine here. This one, it is called, so this one, it is called the pterygospinous process. So that is pterygospinous process. And then if you look here, you're going to see there's a fossa. So there's going to be a fossa. It's called a pterygoid fossa. So you can see the pterygoid fossa. And then on top here, so just superior to the pterygoid fossa, you're going to see this depression called the scaphoid fossa. So you can see the scaphoid fossa. It is just above the pterygoid fossa. So we have got the pterygospinous process. We have got the annulus, which you can see there. This one, this is the annulus or the pterygoid annulus. This is the pterygoid annulus. And then we have got also the pterygoid fossa. We've got the medial plate and the lateral plate. So those are the parts of the sphenoid bone. So in the next video, I'm going to talk about what's passing in each foramen. Thank you so much for watching, and please don't forget to subscribe. And also make sure you watch the next video.